Video 1. Problem statement, approximately 60 to 75 seconds. Care partners are essential workers in U.S. transplant and dialysis systems, yet are treated as invisible, unpaid labor. They manage medications, coordinate appointments, navigate insurers, provide day-to-day medical support, and sustain patients through critical moments, yet federal law and clinical practice do not recognize them as workers with rights, protections, or pay. The system demands their presence as a condition of listing and ongoing eligibility, but policies assume this labor is free, unbounded, and without human cost. This exploitation is rooted in structural neglect, not compassionate design, and destabilizes households, careers, and health. And care partners are not ancillary. They are an indispensable part of a care economy that refuses to acknowledge their contribution. This must end. Video 2. Evidence and system failures, approximately 60 to 75 seconds. The burden on transplant care partners spans physical, psychological, financial, and logistical domains. Informal caregivers perform complex clinical tasks that researchers link with significant distress and risk of burnout. Yet there is no formal infrastructure to support them with training, compensation, or workplace protections. Data consistently show caregiver strain across phases of disease and transplant care, undermining both caregiver health and patient outcomes. Federal policies like FMLA provide partial leave but do not cover the duration or intensity of transplant support needs and offer no direct financial compensation. Transplant centers systematically incorporate care partner support into eligibility criteria without acknowledging that this labor is unpaid, unprotected, and invisible in health policy. The result is a system that extracts labor without accountability. Video 3. Call to action and policy demands, approximately 60 to 75 seconds. This exploitation is a policy choice, not a benign byproduct of care. Real reform requires explicit recognition of care partners as essential workers with rights, paid leave at federal standards, direct compensation embedded in Medicare and private reimbursement, workplace protections that ensure employment security, and mental health coverage tailored to caregiver stress. Transplant and dialysis policy must be rewritten to require caregiver support infrastructure, data collection on caregiver burden, and integration of caregiver needs into clinical quality measures.